Well, good morning, everyone. My name is Harvey Weingarten, and I am the principal of the Michener Institute of Education at UHN. So, Premier Ford, Deputy Premier and Minister of Health Jones, let me officially welcome you to the Michener Institute and the University Health Network. We're just delighted that you're joining us today. For 60 years, the Michener Institute has partnered with the Government of Ontario's Ministry of Health to graduate students who move seamlessly into important jobs in Ontario's healthcare system. Our graduates include people like medical laboratory technologists who are performing over 500,000 diagnostic tests per day in Ontario. Our graduates include radiation therapists who administer radiation treatments to cancer patients, cardiovascular perfusionists who operate the heart-lung machines that keep patients alive when they undergo their heart surgeries. We graduate genetic technologists, diagnostic cytologists, who prepare tissue samples to interpret pap smears and help decide whether a tumor is benign or malignant. We graduate medical imagers who use technologies such as CT, X-ray, ultrasound, MRI, nuclear tracing. We use these techniques to diagnose disease and to assess the effectiveness of the treatments that are applied to patients. And we graduate respiratory therapists who sustain COVID patients or premature infants on ventilators when their lungs are too damaged or immature to function independently. That's what we do here. But I have to tell you, we feel a little bit like Wayne Gretzky. When Wayne Gretzky was asked what made him such a great hockey player, he said he knows to go where the puck is going. And that's what Michener does. Michener goes where healthcare is going. We offer programs that train people for where healthcare is going, for innovative new roles. And so Premier Ford, Minister Jones, I congratulate and I thank you, and I thank the Government of Ontario for supporting Michener, which is a distinctive and unique institution in Canada. Michener is a jewel in Ontario's higher education system, and in many ways it is a model for progressive ways of training much needed healthcare workers. And never has a healthcare system been more in need of our graduates. So we're looking forward to the announcement, which in an ironic way means that we're going to have to do more work even harder, train more people, but we look forward to that. And now I pass the podium over to Kevin Smith, President and CEO of University Health Network. Kevin.
Thanks, Harvey. Welcome, Premier, Deputy Premier, and Minister. We're delighted, as always, to welcome you here to University Health Network, and welcome to all of our media colleagues. As Dr. Weingarten mentioned, we are very privileged here at UHN to care for Canada's sickest people and to train those remarkable colleagues who will care for Canada's sickest people. When I look at some of the challenges we're facing across our country, including working now with Newfoundland and Labrador around radiation therapists, those are people who are coming right here to Ontario to learn and to get the skills that are required to treat Canadians, and many of them are choosing to stay right here in Ontario, thankfully. Next fall, thanks to the investment of the Government of Ontario, Michener will also be offering a Fundamentals in Healthcare program that allows students to gain the knowledge, skills, and abilities and competencies to thrive in a meaningful career within healthcare, an area where we know shortages are all too great. We are also very pleased that as we continue looking at the interest that healthcare workers have and the interest that students have, never before have we seen as many people applying to the health disciplines here at Michener and UHN. So I want to thank Premier Ford and Minister and Deputy Premier Jones. I welcome you here. We're delighted to partner with you in expanding the offerings that Ontario students can enjoy so that Ontario patients will get the best treatment in the world. Over to you. Thank you, Deputy Premier and Minister Jones.
Well, thank you, Kevin. I very much appreciate that. Good morning, everyone. It is a pleasure to be here today at the Michener Institute at the University Health Network with Kevin and Harvey. I want to commend Michener for being a leader in helping recruit and train the healthcare workers of the future. And I also want to acknowledge every healthcare worker practicing in Ontario. We know it hasn't been easy. The pressures our healthcare system are facing have been decades in the making and have been exacerbated by a global pandemic. This is not just happening here in Ontario. Other jurisdictions from around the world are facing staffing shortages. To add to this year's triple threat of influenza, RSV, and COVID-19 has placed extra demands on the healthcare system across the country. We continue to encourage all Ontarians to stay up to date with their vaccines, including getting your bivalent booster dose and your flu shot. We are also extending the very successful free rapid antigen test program in grocery stores and pharmacies across the province until June 30th, 2023. I also want to thank our grocery and pharmacy partners for stepping up to help us deliver this program for another winter season. In light of all of these pressures, the government remains focused on ensuring we are not only having enough healthcare workers to deal with the demands of today, but also preparing for the future. It is why we have invested in publicly funded healthcare at record levels. We have ramped up our strategies to bolster Ontario's health workforce by providing increased funding to recruit, retain, and train nurses and other healthcare staff. I'm pleased to announce that we are investing more than $9.4 million to support accelerated critical care nursing at Centennial College, Conestoga College, George Brown College, Laurentian University, Mohawk College, and St. Lawrence College. This funding will help register nurses who want to work in critical care upskill in areas like respiratory, palliative, and cardiac care. The government will also be paying for the tuition of these students, along with all college and hospital costs, including any associated costs related to backfilling their current position to ensure continuity of care. Today, we are also increasing funding to 3 key programs that hospitals use to bring on more healthcare workers. The Enhanced Extern Program, which allows students to work in hospitals in an unregulated capacity. The Supervised Practice Experience Program, which helps internationally educated nurses meet Ontario's licensing criteria faster. And finally, the Community Commitment Program for Nurses, which offers cash incentives for a 2-year commitment to work in an area of high need in Ontario. These incentives help reduce pressures on our hospitals while providing learning opportunities for healthcare workers who will be working in our system for years to come. This year, we will also announce we're breaking down barriers to help bring on more internationally educated nurses in our workforce. And I'm proud to say our plan is working. I know Premier Ford will have more to say on that in a moment. We are just getting started and will continue to work every single day on our plan to recruit, retain, and train the nurses of today and for generations to come. Thank you, stay well, and I will now pass it over to Premier Ford.
That's great. Well, good morning, everyone, and thank you to the Deputy Premier, and thank you to Kevin and Harvey for once again welcoming us to the University Health Network. And I'm thrilled to be joined by Deputy Premier and Minister of Health, Sylvia Jones. She's been a true champion. We're so grateful to everyone here and across Ontario's health system for all their work caring for the people of this province, especially right now. As the Minister mentioned, as we respond to the annual flu season, the RSV, and the COVID-19, throughout the pandemic, the people working in our health system did incredible work under heavy pressure. Nurses, doctors, personal support workers, pharmacists, lab techs, and the list goes on. Each stepped up and continued to step up to provide excellent care. On behalf of all Ontarians, thank you. We rely on our healthcare workers so much, and we're doing whatever it takes to ensure they're supported. That includes expanding Ontario's health workforce. It includes the largest expansion of medical school spots in a decade. It includes giving personal support workers a permanent raise, and it includes hiring thousands of more nurses. While there's still a lot of work to do, early results are showing that we're making good progress. This week, Statistics Canada released new data. Between 2016 and 2021, the number of healthcare workers in Ontario grew by nearly 100,000. That's a 21.5% jump in new healthcare workers in just 5 years. And our own numbers tell a similar story. Between 2018 and 2021, Ontario added over 14,500 net new nurses. And while this year's numbers are still coming in, the College of Nurses of Ontario has confirmed 2022 as being a record year. Ontario has so far registered nearly 14,000 more nurses, with 1 month to go. This includes 6,300 internationally educated nurses who recently started working in Ontario, as our government broke down barriers and provided funding for examinations, certification, and registration. And friends, more reinforcements are on the way. Today in Ontario, nearly 30,000 students are enrolled in nursing programs at a college or university, with thousands more students enrolling each year. That's a pipeline of new talent that will be ready to care for our growing and aging population. And as we train, retain, and hire more nurses, we also want to ensure we take full advantage of their amazing skills and knowledge. That means providing new opportunities to learn and grow in their job. So today, we're providing $4.6 million to upskill nurses who want to work in critical care. These funds will provide nurses with free tuition to study here at Michener Institute and will cover all college and hospital costs, including backfilling to ensure continuity of care. By spring 2023, we expect close to 600 nurses will have completed their upskilling education. That is 600 more nurses ready to care for our most vulnerable in ICUs across Ontario, including our pediatric ICUs. It's all part of our plan to stay open, our plan to provide Ontario's families with the best care possible. It's all hands on deck as we use every tool we have to get more nurses working in Ontario right now. My friends, over the past 4 years, we've made a lot of progress. We've hired thousands of new healthcare workers. We've added over 3,500 more hospital beds, and we'll add another 3,000 as we make historic investments in hospital construction. And we're building 60,000 new and upgraded long-term care beds for our seniors. This is a good start, but we won't stop there. We will continue to invest and support our healthcare workforce to serve everyone in this province. We're putting your health first as we build a stronger, more resilient health system for generations to come. Thank you, and God bless the people of Ontario. Thank you.
The floor for questions. If reporters lined up behind me at the mic could please identify yourselves by name and outlet. And just a reminder, it'll be one question and one follow-up. First question.
Hey, Mr. Ford, good morning.
Hi.
Hey, so...
And who's this?
Oh, yeah, Aidan Schmandy, Queen's Park Briefing.
Yes.
Sorry about that.
That's all right.
On the Greenbelt, there's 2 parcels of land in particular that were purchased in the last 2 years I want to ask you about.
Sure.
One was a $50 million purchase in spring 2021.
Mm-hmm.
The other was an $80 million buy a few weeks before you announced the Greenbelt plan.
Sure.
Both of these buyers have strong links to the PCs, including donations and hiring lobbyists who worked closely with folks in and around your government. And I'm wondering why you think these folks would have paid so much money for land that was, essentially worthless a few months ago.
Well, we had strict criteria when it came to changing over anything. But what we're focused on, first of all, we added over 2,000 acres to the Greenbelt. Since I've took office, The Greenbelt is larger than it was prior. And I just want to remind everyone that the previous government, under the Liberal regime, they changed it 17 times. We have a housing crisis. That land is going to build at minimum 50,000 homes. A lot of them are going to be attainable and affordable homes for new Canadians coming and young people. And we're going to continue making sure that we fill the gap, as we call it, and stop the housing crisis. And it really comes down to supply and demand. So we look forward to continuing building homes for people.
Can you definitively say that you and no one associated with your government gave any advance notice, either directly to the developers or through any kind of intermediaries, about this plan?
Yeah, I can confirm that, but again, we had very strict criterias that has to be close to an existing development, and we're just happy that we're going to hold these people accountable to start building attainable and affordable homes for the next generation. Folks, we have over 300,000 people that are showing up to Ontario and the Greater Toronto Area every single year. In 3 years, it's going to be close to 1 million people. In 10 years, it's going to be 3 million. And we have to still fill the gap with the existing backlog that we have of people not being able to afford a home for their families. And everyone wants their little white picket fence and the key to put their door to open up and call it their own. And that's our goal. We're going to work collaboratively with all 3 levels of government and make sure that people have attainable and affordable homes.
Hi, Premier. Rob Benzie at the
Hi,
Star.
Rob.
I wanted to ask you about the Auditor General's report, and specifically, what did you think about the auditor dispatching undercover operatives into Ontario casinos to try to detect money laundering? I gather the Ontario Provincial Police were not happy with her and her team for doing that. What do you think about that?
Yeah, thanks for that, Rob. First of all, I can't speak for the police, but I know I'm sure they wouldn't be happy, be it the OPP, local police, or RCMP. The Auditor General has to stay in her lane, and focus on where there's waste of money. You can't do a sting operation. You can't all of a sudden deputize yourself and think you're the Secret Service going around doing sting operations that failed, by the way, and they were caught. Now these poor folks that they hired are now banned from the casinos. So she needs to stay in her lane, focus on value for money, and I think she's had a problem doing that over the last little while.
So you sound a little like Premier Kathleen Wynne, who used to say essentially the same thing. Is this something, and the Tories in opposition welcomed her mission creep? I guess in government it's a different story.
Yeah.
But I mean, in the Sun and the Star this morning, the columnists who cover Queen's Park both use the same term, mission creep. Is this something that you have detected? I gather your predecessor detected it as well as Premier.
Yeah, it seems like a pattern with this Auditor General, focus on value for money. I welcome the auditors. When I was in the City of Toronto, we used to work hand in hand with the auditors trying to find wasted money because, they have an opportunity to dig deep in audit areas, and I welcome that. I always say there's no government out there that there's no waste, no matter if it's a municipal or federal or provincial, but I welcome it. But when they do jurisdictional creep, just stay in your lane, focus on value for money. That's your job, and hopefully they'll continue going down that road of value for money.
Hi, Premier. Alan Hale from Queen's Park
Hi,
today. We've heard that the province has agreed to make Toronto whole from the impacts of Bill 23 on development charges. Mm-hmm. Will you be doing the same thing for other municipalities? And is this an admission that the bill does actually harm municipal finances?
Well, I don't believe it does at all. I spent 4 years down there as part of the audit committee, the vice chair. I know there's waste down at the city, and we want to work collaboratively with all the cities and municipalities. Our goal at the end of the day is to build homes, affordable homes, attainable homes. And we are not going to, budge on the development fees. And I find it staggering that the cities, and I'm not just pointing out Toronto, would actually want to charge on affordable and attainable homes. It just doesn't make sense whatsoever. Rather than, work with us, and we have a solution, and work hand in hand to achieve affordable and attainable homes, they want to increase the development charges. Who does that during a housing crisis? No one does that, and we need to work together, and we need the federal government to step up too and work with us. But something, at the end of the day, we should all work collaboratively together, all three levels of government. I have to give my minister a shout out, Steve Clark. He's done an incredible job. He's put an incredible program and a plan together to make sure that we have homes for all the new Canadians that are coming, homes for young couples and people that can't afford it right now. So that's what we're going to focus on. We have a plan. We're asking them to cooperate. And again, you can't campaign on affordable and attainable homes on October 24th and October 25th, come out and say, we aren't doing anything about it. That's just not fair to the people. We want to make sure it's affordable, and they want to charge additional charges. And make no mistake about it, it's going to the consumer. The consumer is going to pay the price. That's what increased the cost. So let's all work together and start building homes.
As someone who was on the audit committee, I'm very interested to hear more about this thing on waste. We've heard that part of this agreement with Toronto is that you want an audit of the development charges reserves. Minister Clark, in question period yesterday, suggested that some of the municipal information about DC reserves is inaccurate and could require a deep dive. And we had the Home Builders Association come to the legislature yesterday with a report that they say indicates that municipalities are exaggerating the impact of Bill 23 on their finances.
Yeah.
Do you agree with that? And will you be doing audits of other municipalities beyond Toronto?
Yes, we'll be auditing other municipalities because we know there's waste. And I don't want to pick on municipalities. Let me be very transparent. There's waste in government. There's waste at Queen's Park. There's waste in municipalities. There's waste at the federal government. And it's our job as prudent fiscal managers for the taxpayers to drive out the waste and help them. The easy thing to do for any politician is to go up and say, we're going to increase development fees, which is a tax on the home buyer. That's what it is. And it's just not fair. And I'll give the people at home an example. Out in Mississauga, before you get the shovel in the ground, they're upwards to $135,000. And they want to increase that. Well, guess who's going to pay for that out in Mississauga? The young couples, the new Canadians that are out there, and they just want to keep tacking it on. We can't continue doing it. And by the way, they're going to still get their $135,000. But when it comes to affordable and attainable homes, we're saying no. How can you tax social programs that the government's paying? And I remember Mayor Tory even agreed at one time, I'm not too sure where he's standing now, but on social programs and attainable homes and affordable homes, it's like the government taxing the government. It doesn't make sense. But again, I want to work with them. I want to build homes. We have a plan, and we're going to continue building on our plan. It's a strong plan.
Morning, Premier. Liam Casey with the Canadian Press.
Hi.
I was at Sick Kids yesterday for work and was talking to a bunch of nurses and doctors, and they were telling me on the day before there was a moment of jubilation, joy, and real morale boost when the decision came down that struck down Bill 124. A couple hours later, your government signaled it was going to appeal, and some of these workers wanted me to ask you, why are you appealing Bill 124?
Well, first of all, I think the world of our frontline healthcare workers, we had a great deal with OMA, and Bill 124 is not going to exist. It's basically not going to exist and doesn't exist when they renegotiate. And we don't negotiate hand in hand. The hospitals, people like Kevin Smith negotiate with hiring the nurses. So, I just want to thank them. Yes, we're going to appeal. My hands are tied on what I can say. It's in front of the courts right now. I can say it was a very interesting verdict, to say the least, but that's about as far as I can comment on that. I think we just look forward to the Court of Appeal because there's precedent throughout the country that they ruled another way. So I'm just trying to rationalize why the ruling came down the way it was. But I have confidence in our judiciary system, our judges, and I'm sure they'll make the proper decision.
Will you use the notwithstanding clause to keep Bill 124 alive?
No, I want to go through the process, and I always believe in treating people fairly. I've never been opposed to, working with them. You saw what happened with QP. I think I'm very flexible, very open-minded. Do you know what the worst thing an elected official or a politician does? And a ton of them do it, like probably 99%. They make a decision, they dig their heels in, and they just won't budge. And then they start doubling down and tripling down. I think I've proved to the people of Ontario over the 4 years, if I feel something's going the wrong way, or if I've made a judgment call, I go out there, I apologize, tell them what we're going to do to correct it, and move forward. That's what you need to do.
Hi, Premier. Lorenda Redekop with
Hi,
CBC
Lorenda.
News. Hi. I'd like to first hear from Kevin Smith, if I could, on this
Sure.
one, and then from
Yeah.
you, which is, what are the nursing vacancy numbers like at UHN right now? And would you describe this as a mass exodus that's happened?
Well, I'll pass it over to Kevin, and the best person on my side would be Minister of Health.
Hope to hear from you as well, Premier.
Yeah, sure, okay. I'd be more than happy. Yes, sure.
Hi, Lorenda. Normally, because of the size of UHN, we're Canada's largest hospital, we'd have about 200 vacancies churning. At the peak, we had up to 600 vacancies, and at the moment, we're working around 400 vacancies. And so we have not seen a mass, quote-unquote, exodus. We have seen more people in higher acuity areas who've been very stressed, like ICUs and other domains, looking at working in lower acuity areas. I don't have the data at my the fingertips, Lorenda, but the other great data source would be the Healthcare of Ontario pension plan, looking at the number of people who are triggering their pensions as exiting. And my understanding is it doesn't look dramatically different yet. Last but certainly not least, the dialogue we're having particularly with our valued nursing colleagues is a number who have left the active treatment side of practice. As we're seeing and trying to bring in more people, international grads, young nurses who we can evaluate in terms of their skill and competency, work with the college to get them licensed. While they're tired and don't want to do direct nursing care anymore, they're more than willing to come back and work with us on mentorship, skills supervision, and education. So we're very encouraged by that side of the coin. I'll turn it over to Minister Jones.
Thank you. You know, the numbers actually show that we have more nurses working in the hospital sector, in the public health units, in primary care. Basically, every sector has increased numbers of nurses. There is no doubt that as a result of the pandemic, it has been a challenging time in our healthcare system, which is exactly why we continue to make the investments, direct the College of Nurses to assess and ultimately license internationally educated nurses. Those numbers are showing historic licensing happening in this year. And I think that speaks to we want to continue to build the capacity and the number of healthcare practitioners who are working in Ontario. We're doing that work in the short, medium, and long term, but without a doubt, it has been a challenging time because of the unknowns of the pandemic and now, of course, the triple threat. Again, if we want to assist as a community, get your flu shot, get your bivalent vaccine. That ultimately is going to do a lot to protect our emergency departments in particular and our healthcare providers. Thank you.
Yeah, I'm going to, very similar to Kevin and the Deputy Premier. We have spent unprecedented amounts when it comes to making sure that not only do we enhance the infrastructure of hospitals to a tune of $50 billion and close to 50. It's probably about a little over 40 now, but it'll be up to $50 billion with 50 sites across the province. We're hiring more nurses. The College of Nurses have come out and said we've had a record year. We still have another month left in that. We brought on over, and I got to give the College of Nurses a real shout out. They really stepped up. They've brought in over 6,000 internationally trained nurses. We're going to have them into the system as well. But we haven't spared a penny when it comes to HHR, Health Human Resources. And has it been a challenge? Sure, it's been a challenge. But we have a record number of students in the system now, over 30,000 of them. And we welcome all the new students on top of the med schools. We've brought in more med students than we've ever seen in 2 years, with adding to the Scarborough University of Toronto Scarborough campus, along with building a new med school in Brampton. So we're going to continue to invest unprecedented amounts. Last year's budget, we increased it by $5.6 billion. The year before that, $5 billion. And I want to thank, too, are the CEOs, true leaders, like Kevin Smith, that are always there thinking outside the box. And there's many of them like Kevin, coming up with new ways to deliver healthcare through technology and other systems, through processes. And they're just absolute champions. Everyone's working together to make sure we have a great healthcare system. And I truly believe we have the best docs, the best CEOs, the best nurses, the best healthcare workers anywhere in the world. I'll put our Team Ontario up against anyone in the world.
On the Ontario line, it looks like the costs have absolutely skyrocketed. What are your thoughts seeing that, and is there anything you're going to do about it?
Yeah, well, we've seen that right across the board in any construction, any infrastructure. We see the steel costs going up. We saw, lumber costs going up. Then we have labor costs going up. But we're going to build a world-class transit system. We have 4 lines going right now, and yes, on the Ontario line is going to be done in a hopefully in a number of years, and it's going to carry 300,000 people. We're going to get people off the roads and onto the subways, world-class subway system. Eglinton West, they're, I think, about 6 weeks ahead of time, then Scarborough, then the Yonge Extension. We're finally building a subway system that's going to be world-class, and we're going to continue building onto that to get people out of the cars, onto the trains, and get people home a lot quicker to their loved ones.
Last question.
Sure.
Hi, Premier Siobhan from CTV News.
Hey, Siobhan, how you doing?
Good. We saw some pretty disturbing findings in this report on the Ottawa LRT. I'm wondering what bothered you most about it and what the path forward is for the LRT now.
Well, there's a lot of frustrating stuff that we saw, and thank goodness we did the inquiry. We saw Mayor Watson not being transparent with his councillors. We saw the city manager having to step down. It was just absolute in shambles, and stunk to high heaven, and we wanted to dig deeper, and we did, and it's come out now. So we're going to continue moving forward. But I think they did a terrible job, Mayor Watson. I'm being very frank here. He wasn't transparent. He didn't oversee the project properly, and he's gone, and so is the city manager and some other people that worked on it. Hightailed out of there because they knew it was a disaster, and the people of Ottawa knew it was a disaster. So. The people of Ottawa finally have an answer now.
Premier, it's Richard Southern with City News.
Hi, Richard.
Follow-up. Hello, sir. Are you not using the notwithstanding clause in the Bill 124 because you learned from maybe your mistake with the teachers? And can you also tell taxpayers how much of their money is going to be used in this court appeal, sir?
Well, thanks, Richard. No, not at all. There's a reason why it's in the Constitution. It's there to be used at a certain time. All I was trying to do is I'm trying to collaborate When QP was out on strike, it affected everyone. It affected people, the nurses here that had to stay at home possibly. It affected the economy. It affected the parents and the students. So I just, again, I always do my very best to work out a deal. And there's, when you're working out a deal and trying to negotiate, it's not always easy for both sides. But the good news is the kids are back in the classroom. They have extracurriculars, and we look forward to working with the other 8 teachers' unions to make sure the kids continue learning in the classroom. Listen, the kids and the parents have went through a real challenging time over the last 2.5 years, and I've been talking to a lot of kids and my own niece and nephew. I've never seen kids that want to be in school so much, to be around their friends and learn. And let's just work together and keep the kids in school.
Thanks so much.
Oh, okay. Thanks so much, everyone. You take care. Thank you.